Hello everyone, we are Group 13. Our presentation is titled Healthcare Access and Financial Challenging to the Aging Population in Kedah. This presentation, we will focus on two main challenges faced by elders people in Kedah, which is healthcare access issue and financial difficulty. We will also provide a discussion and recommendation to improve their quality of life. We have 6 members in our team.
Let's look at the current situation. Malaysia's population is aging quickly, and this is especially true in Kedah. In fact, since 2021, we have officially become an aging society, with more than 7% of people over 65, which is actually above the United Nations benchmark. Now, Kedah, being a largely agricultural state, has a double challenge: a big rural population and young people moving away for work. This really worsens the aging crisis here. So what are the main problems? They really boil down to two things. First, access to healthcare, and second, the financial burden. Many elderly live far from clinics and have no easy way to get there. At the same time, they are dealing with more chronic illnesses, but the high cost of care means they often have to pay out of their own pockets. This is so expensive that many are forced to delay getting the treatment they need. And it directly hurts our elderly. Their health suffers and their quality of life declines. And it also puts a huge strain on our public hospitals and clinics, and even slow down our economic growth. So the bottom line is, for many older people in Kedah, getting to a doctor and being able to pay for it is the biggest struggle. In order to tackle this, the government must boost healthcare and provide better financial support for our elderly. By taking these steps, we can manage the wide-ranging effects of an aging society and truly improve the life of our older populations. Therefore, our presentations has highlighted the serious situation in Kedah, and we strongly stress that proactive policy is the key to managing this demographic shift successfully.
Now, let's move on to the first healthcare challenge among elders people in Kedah, the geography factor. As we know, many elders individuals live in a rural or remote area, while most public healthcare facilities are mainly located in urban centers. This means that elders people often need to travel long distance to access high-quality medical service, making regular visit challenging. On top of that, rural healthcare services are still underdeveloped. According to the Health Ministry 2023 announced report, healthcare services in rural areas are less developed compared to the urban areas. This shows an unequal distribution of service and specialists. As clinic and specialist doctors are unevenly spaced across the states, which future limit access for the elders in rural areas. The second healthcare access challenging among elders people in Kedah is mobility constraints. As people age, many experience reduced physical ability such as difficult walking, joint pain or health conditions like vision or hearing problem, diabetes and hypertension, which make frequent visit to clinic or hospital difficult. Moreover, the prevalence of non-communicable disease increase with age, meaning older adults often need to use healthcare service more frequently. However, long waiting time at government facility can cause physical discomfort and reduce their motivation to attend follow-up appointment, future limiting their access to proper healthcare.
The appropriate ability of the older people to access treatment can also be affected by health information barriers or lack of health literacy. It is manifested in the fact that many older people have difficulty in understanding the doctor instruction they receive, unable to follow up the schedule of taking the prescribed medicine, to know its dosage or how to interpret health check-out results, which put the patient at the high risk for using or consuming higher medication, missing up on follow-up and failing to stick to the treatment. In Kedah, this also happens and is more problematic in rural areas, where the health campaigns are limited. Most of the older people are not exposed to the MySejahtera apps and the form of government information related to health awareness. Consequently, more health officers only rely on verbal explanation to provider. So when the explainers use medical terms or do not communicate clearly, older people are difficult to understand the need for treatment. There is also a problem of language use as some older communities are more conversant with the Malay language, but the language that health officers use are more English format. Therefore, more friendly information materials should be designed for the elderly to ensure the older people can access health service effectively. There is a challenge for health service itself. Public health facilities in Kedah are often overcrowded, understaffed, or there is a shortage of equipment in hospital. Major hospitals like Sultanah Bahia Hospital, Puri Hospital receive a high number of patients every day, and cause too long queues make it impossible for as people with chronic health conditions or difficult in moving to wait for long hours. Additionally, lacking geriatric specialists is also a challenge. According to the Health Fest 2021 report, there are not enough geriatric specialists in the doctor states, including Kedah. Most government clinics in the rural areas offer primary treatment and do not have testing laboratories or pharmacies, causing patients to travel to different facilities and creating physical burden. This shows that constraints in health service system are also an elderly health access barriers in Kedah.
Alright, so for the next is financial challenges among elderly in Kedah. So Kedah's elderly population is actually growing and many of them face the financial difficulties due to the limited income and increasing the living costs. Most of them rely on the savings or supports from their children, but it's actually not enough for them. This issue will give them matters because it will affect to their daily life and then health and etc. and also their overall well-being, and shows why better support is needed. Okay, so for the first point is about the income struggles among the elderly. So many elderly in Kedah earn very little, which is they are usually in rural areas who often receive less than 870 ringgit a month. Most of them depend on savings, small government aid, or help from their family. Their retirement savings are usually low because many work in informal jobs and didn't contribute regularly to EPF. This will put them at risk when unexpected expenses happen. And then the second point is about the low earnings and rising expenses. So elderly households earn far below the state of average, while the cost of living keeps increasing. According to EPF, seniors or elderly need around 2,690 ringgit a month. There are so lots of amount, but many are far from reaching that amount. They also spend over 1,000 ringgit a year on healthcare and also transportation and other basic needs, creating a big gap between the income and also expenses. And then the third point is about heavy OOP burden or heavy out-of-pocket burden. So out-of-pocket here is about the medical costs that take up a large part of elderly income, especially for those with chronic illnesses. Many the elderly spend up to 1,300 ringgit a year on healthcare, leaving less money for food and daily needs. This financial strain affects their quality of life and shows why stronger support and protection are very important for them.
Lastly is low saving. Large number of elderly people rely on personal saving or financial assistance from their children rather than official pension. And most senior citizens in Malaysia have a chronic illnesses and require ongoing treatment, making them unable to make savings. According to a study on senior well-being in Northern Malaysia, Rahman and Samad 2022, older adults often prioritize medical expenses over nutrition and recreation, leading to compromised quality of life. Now, Several measures can be taken to overcome those challenges. First is increased financial assistance for low-income senior citizens, especially in rural areas, either in the form of monthly subsidy or special financial support program. Second is design specific health programs for senior citizens, such as setting up mobile clinic or free treatment facility in remote areas so that no OOP expenses are included. The third is bank or government can introduce volunteer retirement savings scheme for informal sector workers so that they have savings when they retire. For the fourth is government can develop health and transportation facility to facilitate access to treatment. And lastly, government can also provide social and community support, including senior citizen activity centers, volunteer, and financial support groups to help ease the burden on senior citizens and their families.
Vision and hearing changes also with an elderly, mostly of elderly with age, vision can become blurry and hearing may decline. Common age-related conditions including difficulty focusing on close subjects and age-related hearing loss, and also the routine eye and hearing exams help detect and manage those changes early for tackle the issues.
In conclusion, the elderly in Kedah, particularly in rural areas, face significant barriers to healthcare. Issues like long distance, poor transportations, and a shortage of medical specialists often lead to delayed treatment, worsening health outcomes. And these situations create ripple effects. It places a heavy burden on families and drives up national healthcare costs. Compounding this, lower health literacies, limited digital access further isolate and endanger the rural elderly. So, upgrade rural clinics, expand mobile health service, provide clear, accessible health information, and strengthen our financial support system is the key solutions in order to address these challenges directly. So, as Malaysia's population age, building a fair and inclusive healthcare system is not just a policy goal. It's a moral imperative to secure a healthier future for Kedah's elderly. Facing the challenge of an aging population requires more innovations and collaborations. Aging health, everyone's responsibility. Thank you for listening.